Moving right along, let's get into movements as well as some of the muscles. And then we should only have about 15 minutes or so, probably less, and done with this week's videos. So flexion, right? Going to be bending the elbow, decreasing its angle. Extension, we're going to be straightening the elbow, increasing its angle. Pretty common for you guys already. Pronation, we're going to be bringing an internal rotation of the radius on the ulna. So it's going to be palm up to palm down. Supination is going to be the opposite, moving from palm down to palm up position. Palms forward, supination, palms down, pronation. Predominant joint that's going to be going on here is going to be radioulnar joint. So it's going to be that rotation of the radioulnar joint, the actual rotation or pivoting of the radius in the ulna. So the primary muscles that are going to be responsible for elbow flexion, we're going to have a biceps brachii, we're going to have a brachialis, we're going to have a brachioradialis, and we're also going to have some very weak pronator teres assistance as well, because it's going to span the elbow joint. Our elbow extensors predominantly are going to be our triceps brachii, and then we're going to have our Anconeus as well. That's going to be an assistance mover. For pronation, we're going to have Pronator Teres, we're going to have Pronator Quadratus, as well as our Brachioradialis. For radioulnar supinators, palm forward, we're going to have our biceps brachii, our supinator muscle, as well as our brachioradialis. So on the anterior side of things, we're going to be talking predominantly flexion and pronation, which means we're going to have our biceps brachii, brachialis, brachioradialis, pronator teres, and pronator quadratus on the anterior side of things. Same muscles, just a different compartment that we're looking at this stuff in. On the posterior side of things, we're going to have our triceps brachii, our Anconeus, as well as our supinator. Right? Same muscles that we just went over for flexion extension, just anterior, posterior side. If they're on the anterior, predominantly flexion and pronation. If they're on the posterior, we're going to have predominantly extension and supination. So let's talk biceps brachii. Biceps are going to be responsible for flexion of the elbow, as well as some supination action as well. They're going to be responsible for a horizontal adduction of the shoulder joint and weak flexion of the shoulder joint, because they're going to actually span the glenohumeral joint. Biceps brachii are predominantly going to be responsible for flexion of the elbow, right? So flexion of the elbow when we're supinated. So biceps brachii, it's still flexion, right? Now our brachialis muscle is going to be doing a very similar thing, except it's going to have an origin on the very distal side of the humerus and an insertion on the very proximal side of the ulna. The predominant action of the brachialis is going to be true flexion, right? So you're going to have biceps brachii, you're going to have brachialis, right? So like think hammer curls. That's going to be your biceps brachii, and that's true flexion of the elbow. And now we're going to have our brachioradialis muscle. This is going to be flexion of the elbow again, but it's going to be pronation from a supinated position to neutral. So it's going to be supination from a pronated position. So think biceps brachii, brachialis, brachioradialis, right? So all the different curls that you would normally do to hit the guns, it's for a reason, whether or not you know it. But doing different curls like palm forward curls versus hammer curls versus Zottman curls, each one of those are going to be hitting different bicep flexor muscles, and they're going to be each doing a different action. You're actually training different parts of your elbow flexors. Now your triceps brachii muscle, all the heads are going to be responsible for extension of the elbow. All the heads. Triceps, 3 heads. You're going to have a lateral head, a medial head, and a long head. And that long head of the triceps is going to be what is responsible for extension of the shoulder joint, as well as adduction of the shoulder joint and horizontal abduction, right? So in general, that long head is going to be responsible for shoulder extension somewhat. That's why if you do certain types of, like have you ever done those cable pulls, trying to hit your lats? Sometimes when you're going through that motion, you can feel like the most wicked tricep burn ever. If you've ever had it, you know what I'm talking about. That's actually going to be that long head of the tricep, because it has an origin on the scapula, so it's going to be responsible for some of that extension. But in general, all the heads of the tricep are going to be responsible for elbow extension. Now, the Anconeus muscle is going to be responsible for extension of the elbow exclusively. And it's going to be present to really help benefit the biomechanical advantage of the tricep. So it's really helping to just pull on that. It's really helping to just pull on that posterior surface of the ulna and help kind of bump that elbow forward some, so that we can actually be pulling and enhancing the amount of extension that is occurring. Our Pronator Teres muscle, exactly what it sounds like it's going to be responsible for. It's going to be responsible for supination. Just kidding. It's going to be responsible for pronation, right? Pronator Teres muscle. And because it spans the elbow joint, it's got an origin on the distal part of the medial condylar ridge, it's going to be responsible for some flexion because it spans that joint. But for the most part, Pronator Teres muscle is going to be responsible for pronation of the forearm, right? So what's pronation? Palms down. And then our Pronator Quadratus is going to be responsible for pronation of the forearm as well, right? Pronator Quadratus. And you can tell that it's a quadratus because it looks like a quadrilateral. I think most of you guys did this in the assignment where we had to talk about how muscles were getting their nomenclature. So Pronator Quadratus, it has an origin on the anterior side of the ulna, and it has an insertion on the distal fourth of the anterior side of the radius. So if it has an origin on the ulna, an insertion on the radius, then it's going to pull the radius over top of the ulna, and it's going to be a pronation action. And then our last primary muscle associated with the radioulnar joint, or the elbow, which is what the kind of whole lecture has been about, right, is going to be the supinator. Let you guess what this supinator is going to be responsible for, right? It's going to be responsible for supination. It's going to have an origin on the lateral epicondyle of the humerus, and it's going to have an insertion on the lateral proximal radial head, right? So it's going to be responsible for taking and pulling that radius over top of the ulna and into a supinating position. Elbow joint's a little bit easier than the rest of them. At least I think it is. The radioulnar joint as well, right? There's only so much you can do to rotate the radius in the ulna, on like the radius inside of or on top of the ulna, and there's only so much that you can do with elbow extension and flexion. It's fairly simple movements, and as a result, it's fairly simple muscle physiology and fairly simple joint physiology.